In fact, that leaves me thinking that very recently, actually 2 days ago, one of my friends whom we consider probably one of the most healthy looking, well, that's how we often define health, right? How do you look? How slim are you? How fit? How's your skin? So must be in his mid-40s, very slim and trim. But to my surprise, his blood tests were also absolutely fine. And his cardiac blood test, cholesterol, everything was in control. But he got a CT angio or an angiography done, and there was 90% blockage in one of the main arteries. And he called me frantically, and he sent his reports to me and wanted my advice. And I picked up the phone and I said, hey man, you should be in the hospital. But doc, wanted to understand from you, can this really happen where cholesterol is within control, all other parameters are in control, your weight, you're slim, you don't have any, you're a teetotaler, but still you might have blockage in the artery?
Yes, you can, although your chances are much, much less than someone who's careless about their health.
Sure.
But the first factor in this is genes. Genetics is very important, and while you can overcome genetics to some extent with good lifestyle, sometimes you cannot help it. But if your genes are driving you towards that, you'll probably go towards that. There are also other rarer conditions which are beyond the scope of discussion, which also lead to early sort of heart attacks or early heart disease. I don't see why he had a CT angio done, though. There must be some reason.
Yes, I did ask him. So he did mention that he was having some pain in the jaw, neck, and on the left side for like a couple of weeks. He had some symptoms, and he was wise enough to go and get a CT angio.
So that's very smart, and that's the right thing to do.
Yes.
So these surprises happen. But when you look at statistics, such people, these are exceptions, which is why we are talking about them. But this is not the usual profile of someone who gets who gets a heart attack or a heart condition or has a 90% block on a CT angio.
Right.
So if you start looking at it like that, everyone should have a CT angio then.
Yes.
So I think that's probably sort of too much. I don't think we should look at it like that. But he did have some symptoms and he went there. What I have found is a lot of people who visit gyms and you know, indulge in or practice bodybuilding actually are not very healthy. And there are two reasons, not about him, in general, and because he also mentioned that. So one of the reasons is that we are talking of exercise. People who look good, they may not be doing enough aerobic exercise.
Right.
Correct.
So they may just be doing bodybuilding, right? Or there may be others who are good at aerobic exercise, which is the vast majority, but don't build their muscle at all.
Right.
So you need a judicious mix of these habits. Nothing complicated, just a simple mixing, 3 days of that, 2 days of that, you know, and maybe some yoga for stretching and mental health. So if you do that mix, then your chances of getting into trouble are much, much less. So yes, but there will still be some people like your friend who got into trouble.
Yes.
The other thing that I found in people who visit the gym frequently, which is probably not a subject today, or maybe we can discuss it, is there is a lot of use of anabolic agents.
Steroids,
so,
anabolic agents.
And we don't know the kind of doses of testosterone that some of these people use is unimaginable and not recommended by any sort of study, any guideline. And what happens is that they keep doing that, and then their coronaries go for a toss, and then they'll end up with the cardiologist. Or if they survive that period, whenever they try to give up testosterone, huge amounts of problem happen.
Right.
The first one is that their libido and their sex drive goes. Many of them get married and then they're struggling, and so many of them come to us. I said, but how come your testosterone is zero? Well, because he's taken like astronomical doses for several years. So now body's lost its capacity to make anything.
Right.
So I'm just using this to explain to people, please do not go for hormonal enhancement of your health in the gym or under advice of anyone who is not a trained medical professional. Enhancement of health, treatment of disease is different. Enhancement of health based on exogenous hormone administration is a problem and should not be recommended.
Correct.
It's a very
That is a
unhealthy
very,
practice of
very
bodybuilding.
important point, Doc, and I'm sure that everybody who's listening to your advice will definitely take it seriously. Coming back to Dr. Ambrish once again to you, And let's be honest, men often talk about the horsepower of their car, but when it comes to the blood flow of their body, they subtly avoid the subject. So, why is sexual talk, their libido, or let's say the blood flow of their actual body such a big taboo when it comes to talking about it?